Hi, everyone, and thank you for being here to watch and listen to my presentation on the Peabody Picture Vocabulary 4th/5th edition. The textbook had mentioned only the 4th edition, but upon my research, I saw that there is a new and improved 5th edition out. So a lot of what I will be presenting today will pertain to the 5th edition of this assessment as well. So, what is the Peabody Picture Vocabulary Test? It is an assessment of receptive vocabulary skills. And by receptive, I mean it will assess how well a student can understand a word that is being spoken to them. This test is appropriate for individuals ages 2 years, 6 months, and above. In much of my research, I've seen that not only is this test used in schools, it is also often used in adults who have or are recovering from traumatic brain injuries to assess some cognitive abilities. This test is a reliable and valid test that can work in conjunction with other evaluations to determine cognitive impairments, language disorders, and can be a clue as far as potential disabilities or potential further testing should that be necessary. As of now, this test is available in English only. However, there is a Spanish test that is similar to this one. The Before in the previous slide, I discussed the receptive component of this test. So, as mentioned, this test will assess someone's receptive vocabulary, so how they are understanding a word that is spoken to them, versus expressive vocabulary, which is how well an individual can use the vocabulary that they know. So it's kind of like an input output kind of situation. Now, what's interesting about this test is that it is most often used in conjunction with the expressive vocabulary test. So it does give a whole picture of this kind of language skills. The test consists of 175 words. There are 20 categories of words, and all the words are concrete images. So they're all things that can be seen. I will talk a little bit more about this later on in the presentation, but for example, objects, maybe a person or an animal doing something that is clearly visible on the illustration or picture, as opposed to a more abstract kind of vocabulary word. Here we see an example of what the test looks like. The newest versions of the test are available in color. As you can see here, we see 4 images: cherries, grapefruit, artichoke, and radishes. So the examiner would flip to this page on an easel or on a table board book and would give the direction, point to the grapefruit. The examinee would then point to the word, or point to the picture rather, that they associate with the word grapefruit. The tester can then continue to stay on this page and perhaps then say, okay, now please show me the artichoke. And the examinee would then point to that picture. Here's another example of verbs, the type of verbs that are used in this test. So in this instance, the examiner might say something like point to laughing. And as you can see, there's a picture of crying or hugging, laughing, sleeping, walking, and the examinee would point to the picture that depicts laughing. One thing to notice that this test is untimed, so the examinee does have some time to consider all 4 pictures, and that is not a component in the scoring of this test. Now let's talk a little bit about the accommodations that can be made here. You may have noticed that that what I've said in the past couple of slides, the examiner uses the language point to the grapefruit. In the YouTube videos that I watched of the administration of this test, that is the language that all of the testers used. However, let's say someone has a motor impairment and cannot point. You can see under each image there's a number. So in those kinds of instances, an examinee might say 2. indicating that they know that the picture of the grapefruit is in the box with the number 2. Additionally, if there is an individual who does not have an ability to speak, the examiner can say which one is the grapefruit or point to the grapefruit, and the examiner can point to each picture and wait for a yes or no signal from the examinee. So there's many different kinds of accommodations that can be made for several handicaps or disabilities. So when administering this test, you must determine a basal and a ceiling. There's an age specific start slide or page that you would begin on. And after 3 consecutive correct responses by the test taker, you have established your basal. And after 6 consecutive incorrect responses, that would be your ceiling. And then you would say your assessment is complete. So even though there are 175 possibilities, normally a test taker is not asked 175 words. This test is very quickly administered, usually in the span of 10 to 15 minutes. So let's talk about the reliability of this test. So there's a mean of 100 with this test and a standard deviation of 15. Test takers in the norming sample had an internal consistency of 89 to 97% reliability, which indicates that if that same individual were to take this test several times over a period of weeks or months, they are typically to score the same 89 to 97% of the time. This score is considered to be a good to excellent reliability score. The validity of this test, one way that we can assess this is because it's often taken in conjunction with the expressive vocabulary test. We can see how well those scores correlate, and they correlated about 80 to 84%. So that is also considered a good validity score. Also, the content of the test, the words that were chosen, were selected based on the frequency and common usage of vocabulary across all the domains that were chosen for the norm sample. Things that were taken into account were age, parent education, sex, disability. So those 2 things indicate a high level of validity with the test. There are also other tests that were shown to be taken in conjunction with this test. One was being the CERF test, CERF, which also provided a valid correlation score. As we know, with all standardized tests, there are limitations and biases. I didn't think that the ones for the Peabody picture vocabulary test were very jarring at all. It's very easily you can make accommodations quite easily. However, as I mentioned earlier, this test can only show concrete images. So items, an action someone is taking. But let's say, for example, the word funny, which I mentioned before, a more abstract word. The word beautiful might be something that is more abstract and wouldn't be appropriate for a test like this and could skew the reliability and validity of the test because it's more abstract. So there definitely are some limitations on the types of vocabulary that it can assess. There is also some speculation that individuals with autism have a skewed score on this test, not because of any kind of cognitive impairment, but more because their vocabulary acquisition is atypical to those of their peers, but not necessarily an indication of anything wrong cognitively as far as vocabulary goes. Also mentioned before, this test is only available in English due to the fact that you must be able to see the pages of this test. It's not useful to assess blind individuals. And it's not able to identify deficiencies in morphosyntactic skills. And what I mean by that is while it can assess your vocabulary, it can't assess how well you might understand that vocabulary in a series of words. This is a single word test. It wouldn't give any information regarding someone who is perhaps unable to understand or form whole sentences in correct order. In closing, um, I really came away from this seeing this test as extremely valuable, um, not as a diagnostic tool, but when used in conjunction with other tools. And since it is so easily administered, examiners really do not need any training for this. While it's preferable, of course, you're really just asking someone to point to a series of pictures. It's very quick to administer and score, and it's highly accessible for most individuals. It's a great test to give to indicate to let an educator or an administrator of the test know if further testing is required or would be beneficial for this student. It would be highly indicative of some kind of language processing disorder and really could be a very useful tool in determining who might benefit from further testing. Thank you so much. I hope you learned a little bit more about this test today. And again, thanks again.